Hello, Dr. C here. We're going to talk today a little bit about sleep. Unfortunately, we have to sleep. I don't like the fact that we have to, but let's face it, a third of our life is in the bed. But we have to deal with that. A lot of people have said, why do you have to sleep? Well, believe it or not, they're not really sure why. They've looked into it, but I don't see any tremendous experiences telling you exactly why we have to sleep. They have some theories, however. The theories are that you need to restore some of the integrity of the nerve cells in the brain. Well, okay, I can understand that. Then there's the people who have the theory that, evolutionary theory, you slept at night so that you'd be wide awake to fight all of the animals and stuff in the morning. Well, I can understand that, but I don't think that's the reason why we have to sleep. Then there's the people who say that you have to do a lot of your processing of the information that you gain during the day, you process it at night. They say that a lot of it goes into your memory at night. Again, you can't prove it, but those are the three little theories that they have that you have to sleep. Now, I thought it very interesting that, I forget who it was who said it. When you laugh, the world laughs with you. When you snore, you sleep alone. And I thought that was pretty funny myself. So let's talk a little bit about sleep. Now, I'm not talking yet about insomnia. I'm talking about sleep. So basically, what is sleep? It's a condition of the mind and the body in which the nervous system is inactive. Muscles relax and consciousness goes. Now that kind of describes it a bit, but let's face it, it seems reasonable to call it all those elements. 30 to 40% of people have difficulty sometime during their life with sleep. And there are three different types, basically, of problems you can have. Number one could be very temporary, related to some event that happened to you during that day or recently. So that's an acute problem. However, it's different than the acute sleeplessness. Different from that. This is something that's definitely related to an event. Could be something that is a bad event, could be a good event. But there's an event, brings it on, usually lasts only 2 to 3 days, and then you begin to sleep as you usually do after that. Then there's the acute problem. The acute problem lasts anywhere from several days, maybe up to several weeks. That has a few more probable reasons for it. Once the sleep deficit goes over a month, we then call it insomnia. So if you go in to see your doctor, for example, and I haven't slept now, I'm sleeping lousy for the last couple of weeks, they're not going to send you immediately to go to get a sleep workup. They're going to go over all of the different things that could cause the acute problem. And we'll go over those too while we're here. So over a month, it's insomnia. And that's when the formal workup would start. Sleep itself, if you don't get it, if you don't get enough sleep, you feel tired the next day and afterwards. You're fatigued. You may even get a little irritable. You have difficulty concentrating. Some people get tension headaches if they don't get enough sleep. Some people will begin to back away, isolate themselves a little bit because they feel irritable They don't want to be around anybody. So these are all symptoms of lack of sleep. Now again, there's two types of problems. Number one, falling asleep, and number two, staying asleep. In other words, waking up several times during the night in order to get your full night's sleep. And remember, we need to get anywhere between 7 to 9 hours of sleep a night. As we get a little older, we may need a little bit more, and when you're younger, a little bit less. But 7 to 9 hours. If you get over 9 hours, that's a problem too. But we'll deal with that in the near future here. So, what are the risk factors? Well, women seem to have more problems than men. So being a woman is a risk, I guess you might say. Elderly. Elderly seem to also have a problem because they do run into many more issues as life goes on. For example, loss of a spouse. That's a big issue. Loss of your domicile. You're not living in your house anymore after you've been there for 30, 40 years. So there are a number of issues in the elderly, and I can understand why that causes a problem with lack of sleep. People who travel a lot, especially if you travel over the line and all. In other words, you're losing a lot of time. So world travelers it's difficult for them to sleep comfortably every night. You may get a change in your job schedule. All of a sudden, you're on the night shift. That will interfere with sleep as well. People who use illicit drugs. People who use prescribed drugs. And there are some drugs that will cause sleeplessness as well. Young students have difficulty also sleeping because they may have an exam coming up, for example, in the next few days or whatever. They may have some difficulty because they're worried about that particular exam. And finally, people who have mental health disorders, especially those with depression or anxiety. They have difficulty sleeping as well. Dementia may cause a problem as well. With males, there may be a problem with the bladder. They got to get up 3-4 times a night because they get that urge incontinence. Remember, we talked about urge incontinence in the odors section that we had last time. So, sometimes they even have to get that prostate cleaned out in order to pass their water so they don't have to get up 3-4 times at night. So what should your doctor do, and what should you do to prepare to see your doctor if you have some problems with sleep? Well, first of all, the doctor's going to do a physical examination to make sure that there's nothing in the disease category that's underlying that sleep problem. Going to review your medications for you. Because as I mentioned, there are some medications that cause a problem with sleep. For example, some cough medicines will cause a problem because the same medicines that dry you up get you a little jittery as well. Sort of like caffeine in a way. They get you jittery as well, and they may interfere with your sleep. So, the doctor's going to do a physical examination, going to go over your medications with you, and that includes medications both by prescription and over-the-counter medications as well, especially the dietary supplements. And boy, we've had sessions on dietary supplements, and I am a big believer in not using a lot of dietary supplements. Don't waste your money on them. But at any rate, this is not why we're here. So the doctor then will go over your sleep chart. In other words, what they're going to do is ask you to write kind of a diary of your sleep. How many hours? How many times did you wake up? How long did it take you to get to sleep? All these things are in that diary. And in that diary, too, are major events that may have happened during the course of that time. So that is your sleep diary. And so you're going to bring that in to the doctor. And he may also ask about sleep hygiene as well. Now, what do we mean by sleep hygiene? Well, what are your eating habits? Did you have a cup of coffee that has caffeine in it just before you went to bed? Remember, caffeine will have an effect for 7 hours. So stay away from that caffeine before you go to bed. Also, don't eat your big meal just before you go to bed. You may have some difficulty sleeping just because of that big meal that you had. In other words, you got to leave several hours after you eat before you finally retire. Also, people love to have a lot of activity in their bedroom. Now, I don't mean sex activity. That's a good thing. But they got their TV in there. They got their earbuds on, listening to it. All these different distractions, basically, that can interfere with your ability to relax and to go to sleep. All the people who are selling things, they love to have people come in with their problem from insomnia. They'll sell you all sorts of things to help you sleep. You need a better mattress. You need a different pillow. You need to have a different type of blanket. You need to have a little bit of music in your room. You need to have a certain color. You need all these different things. You need to have the temperature correct. It's too hot or too cold. They've got all these external things that probably have a little bit of influence on your sleep, but for God's sakes, it didn't cause the insomnia that you may have. So, I know they recommend changing your mattress every 8 years. I tell you, I've had mattress now for, I think, about 12 years. I'm comfortable with it. It knows all my curves and all, knows how I sleep. And incidentally, sleep positions too. They tell you all of the different positions that you can be in, which ones are good for you, which ones are bad for you. I mean, it gets to the point where it's almost ridiculous. I'll give you an example with sleep positions. The most common position people get in is the fetal position, on a side, with the knees tucked up. What's wrong with that? Nothing wrong with that. But some people will say, well, it's going to cause some aches and pains because of the bending of the joints, etc. A lot of that is pure nonsense, but it goes to show the depth that people get into explaining sleeplessness. Well, at any rate. Besides that, hormones. This is especially true with women, unfortunately, right around menopause time. And I can understand that. There's a decrease suddenly in their hormone levels, and there's a problem with sleep. I know that. I understand that. But that doesn't mean that you should be taking extra hormones that you don't have anymore in order to sleep. We'll go over the treatment in a minute. But that is one of the issues that people will have as well. There are sleep labs then that the doctor could possibly send you to if you don't fit one of these general categories of all of these different things that can cause insomnia. They call that a polysomnogram. And there's a lot of different things in that sleep lab that they're measuring. And what they do is analyze each one of these different things and then give you a recommendation as to why they think you have difficulty sleeping. There are a few people who have for example, sleep apnea. In other words, they stop breathing, and then finally when the oxygen level goes low enough, bang, they suddenly wake up, and it's like they have difficulty catching their breath. They'll diagnose that in the sleep lab. And they may even tell you to use a CPAP machine. CPAP, constant airway pressure. Some people have difficulty adjusting to that. And so now they have nasal prongs to deliver that for you. Anything in our society, in our capitalist society, to sell whatever. I'm not saying that sleep apnea doesn't require any of this stuff. I'm just saying that we're a capitalist society. If there's a problem, we got the medicine or we got the instrument to take care of that for you. Okay. Also, stress. Now, I have a whole talk on stress, and I'm going to give it to you probably in another couple of weeks. I'm going to wait till right after the holidays, and we'll talk a little bit about stress and the effect of stress on your body. But stress can also cause insomnia as well. It's that cortisol that is a result of the stress, the cortisol. And so, again, that is one of the things, hopefully, your doctor will be able to pick up and not even have to get this polysomnograph. So, at any rate, how do we approach this now in that sleep lab? There are different stages that we go through in sleep. The first stage is what they call a transition stage. It's when we finally just rest, close your eyes. That's usually pretty brief, usually 5 to 10 minutes, that's it. I know I conk out right away. Usually within 5 minutes, I've gone through that transition stage, you might say. Then we go through the light sleep stage. You spend most of your time in bed in the light sleep stage. That's where your body truly relaxes. You truly relax during that stage. In fact, that's half of the time that you spend in your, quotes, sleep, is in that light stage. How do they define that light stage? They do this EEG, electroencephalogram, and they look at the slow waves. Now, during that light sleep time, these slow waves are there, but every now and then you get these peaks of high waves. That means that the old brain cells are still firing away every now and then, and you can't really get into a deep sleep. So that's about half of the time you spend sleeping. Then you spend about 20% of your time in a true deep sleep. That's when you don't get those peaks on the EEG anymore. It's all nice, slow waves. The body is relaxing totally. It's during this phase that people may get what they call night terrors, nightmares. Or it's during that phase that people may walk in their sleep or talk in their sleep. Is that bad? No, it's not bad. But you need to know that to protect, be safe. And so that's the sort of thing that happens during this deep sleep time. So you got those 3 stages, and then you may get into that rapid eye movement stage, REM. And you've probably heard of REM sleep. It's during this time that we get most of our dreams. And there's people who have made a living analyzing dreams. Sigmund Freud loved to analyze dreams. He especially always noted the sexual connotations within those dreams. Now, I don't know, I get all sorts of dreams. I don't remember the ones during REM, but that's not something you generally remember unless they scared the crap out of you. Then you'd remember them. So, at any rate, you only spend roughly about 25% of your time in that REM stage. And so you go through this cycle. You go through light sleep, deep sleep, REM. Light sleep, deep sleep, REM. You go through this every night. Usually there's about 3 cycles every night. So that's basically what they are analyzing in that sleep lab. For example, too, meditation will cause certain waves. They call them alpha waves on that EEG. Hypnosis will cause a problem with the alpha waves as well. The beta waves on that EEG are the ones that you have when you're totally awake. And then, of course, there's the theta and delta waves when you're asleep. Now, I don't want to go into it any more than that because it doesn't mean that much to you, really. But just to explain a little bit about it, that's all. Okay, so let's go on. The doctor then will do what they call a sleepiness scale. Sleepiness scale. And what it says on that sleepiness scale, what are you doing just before you sleep? And how is that lack of sleep reacting on you during the daytime hours? So this sleepiness scale is how you are sleepy during the day, not at night. So, are you going to sleep, for example, if you're just a passenger in a car? In other words, you don't have to concentrate on driving. Do you get sleepy? Do you take naps? How about if you're ever talking to someone and all of a sudden you just drowse off? Or you may drowse off watching TV or listening to the radio. So all these things are on this daytime sleepiness scale as well. So these are all part of what the doctor in the sleep lab is analyzing. So how do we treat it? How do we treat poor sleep? Well, first of all, the obvious, we try to improve the sleep hygiene. Always go to bed at the consistent time. Same time, get up around the same time. Regulate your diet. Don't eat just before you go to bed. Don't drink that caffeine or eat that chocolate bar or have your Coke just before you go to bed. Remember, 7 hours that caffeine will be effective. Okay. And remember, there's caffeine in all those things. Cola, chocolate, and coffee, and tea, unless you drink the decaf tea. Number 3, are you getting enough exercise? People who are just couch potatoes, they may have trouble sleeping too. So you need regular exercise, 150 minutes a week. We say 30 minutes, half hour each time, 150 minutes every week. Doesn't make any difference what kind of exercise. You got to do some. Okay. Also, it's okay to make your bedroom as comfortable as possible. That doesn't mean you got to go out and buy a new pillow. That doesn't mean you got to buy a new mattress. Doesn't mean you need any of these things in the bedroom. Should be quiet. You need the rest. That's all, basically. Doesn't make any difference what position you sleep in, so don't worry about that. You take the one you feel the most comfortable with. And the last thing is to avoid over-the-counter sleep medications. We'll talk about the meds right now. The most common one that's out there is Benadryl. Benadryl, anytime you see something that has Benadryl in it, I would stay away from it. It's just a simple antihistamine. That's the only antihistamine that we had when I was growing up. And it did put you to sleep for a period of time. After you've used it for about a week, it doesn't work as well. Double the dose. After another week, that doesn't work. So that's not the best reason to take Benadryl. Maybe good for 2 to 3 days. That's about it. Melatonin. Some people will use melatonin. When that first came out, it was 2 milligrams. Now it's 5 milligrams, 10 milligrams, 20 milligrams. We always seem to be increasing the doses of all these medicines. Not you, the pharmaceutical industry. And of course, the more the milligrams, the more expensive it is, and more money in their pocket. Melatonin, again, works fine when you're crossing time zones and all, when you're working at night and you're not used to it. Melatonin will work then. Doesn't work with everyone. Okay. Now there's a number of other medications that are used for insomnia that you can buy. And for example, you can buy the tryptophan, which is the precursor for a lot of these other medicines. Valerian root, very common thing to do, valerian root. Some people will insist on cannabidiol, CBD. If you get the CBD that's made from a particular one of the plants, then it might help. Will it help in the long run? Not so sure. Some people will swear by hypnosis. Some swear by acupuncture. Some like to use essential oils like lavender. Very calming effect that it has on you. Some swear by relaxing teas that have that lavender odor to it. Some will rely on prescription meds, benzodiazepams, like Valium, for example, lorazepam. Some use the non-benzo, they call it, the non-benzos, like, for example, the Restorel or Ambien, or one of those particular medicines. Again, you can get into the habit of taking those if you use them longer than 2 to 3 weeks. So I try to avoid those if at all possible. So those are the things that we use for medications. The best thing is cognitive behavioral therapy. And I don't have the time to go over that with you, but cognitive behavioral therapy is a form of treatment for insomnia. And it is something that certain psychiatrists or at least healthcare workers will use regularly. Those are the basic treatments. That's basically all I have to say about insomnia at this point. I want you to enjoy the rest of this snowstorm that we're having today, and it's nice to be with you. Thank you.